Hi, this is Dr. Andrea Davis, and I am here today, and I'm so excited. The gentleman that is one of my most favorite people in healthcare and PT, especially near and dear to my ACL heart, Dr. Trent Nessler is here joining us today, and I'm going to ask him to introduce himself and some of the things he's accomplished in his he'll say long career, but I know he feels like it's a short career because I feel about the same. Welcome to Expect More with Dr. Andrea, the podcast where we cut through the noise and get real about healthcare, physical therapy, and what it means to truly take charge of your health in today's ever-changing world. I'm Dr. Andrea Davis, physical therapist, straight shooter, and your go-to for no-fluff conversations that challenge the status quo. From the front lines of patient care to the big picture changes in the system, we're diving into what's working, what's not, and how you can expect more for yourself, your care, and your life. Real talk, real solutions, no settling. Let's get into it.
Yeah, first, Andrea, thank you so much for having me. Such a mutual respect for everything that you do.
Thank you,
Um,
sir.
so, so for the listeners, I'm a physical therapist. I've been a physical therapist for just about 2.5 decades, which is crazy. I got
Not long
very
at all.
early, yeah, very early on in my career. I got a big passion around wanting to prevent ACL injuries, which led to a long progression of going back to school, doing my doctorate, focusing on biomechanics, trying to develop an assessment. Fast forward multiple years. And in 2017, partnered with a technology company called Dorsavi to commercialize what is today known as the vMove Plus AMI. And it is a wearable sensor technology that detects sports biomechanics. And from that information, we're able to create more effective exercise programming. And from launching that, it's just been an amazing journey for me. I feel like every day I get to play and do fun things based off of data that I'm getting. And so, one of the things that the EMI has taught me is I don't know what I don't know. And through mass data, because we've collected data now on almost 90,000 athletes across 5 different countries, and just learning so much about human movement, and most importantly, actually, how do we change that movement? How do we create better programming, better exercises, better things to actually improve the way that people actually move? So,
Which is, I mean, that's you say it honestly, and I'll say this, and you'll because you're a humble guy, you're gonna chuckle, but you literally turned my career around with the bringing to market the AMI and the 3D wireless sensors. After I don't know. I think I started in 2017, stumbled on them early in 2017, and it was like no looking back. I mean, I stalked you guys out for it, and it has changed, fundamentally changed how I practice PT. And I love every
yeah,
single minute of it.
that by far, when it comes to the EMI, has probably been one of the things I've enjoyed the most. Is that I get to meet amazing therapists like you, what I call the one percenters around the country, and get to actually exchange dialogue and talk shop and talk biomechanics and talk exercise. It's one of the things, Andrea, that I have enjoyed the most. Because had that not been the case, I don't know if we would have ever crossed paths. And to be able to connect to other therapists who are operating, and I'll say it at a very high level, to connect to other therapists who are operating at a very high level, and to validate that you're actually making a change in the way that people look at things. That's so freaking awesome. You know,
And
I, I,
it's
I,
you should be so proud. And I know we've had many conversations over the years, and again, yet to be in the same room, which was one of my favorite
yeah,
things about our relationship, is that we can have those down and dirty, really like connected, deep conversations around
right.
our shared interests and discussed really for what sometimes ACL rehab looks like and what is being put back out there on the field, which is one of my primary motivations for opening my own practice. And now you with the athlete lab, which is amazing. So Trent's in Tennessee, right, Trent?
Franklin, Tennessee.
Okay.
Historic Franklin, Tennessee.
Have yet to travel to Tennessee, but we're gonna make that happen sometime
You gotta
soon.
come to Franklin. Yes, it's
But
absolutely beautiful.
the evolution, I guess. So I've been a practitioner also 25 years, and the evolution of caring for ACLs on the I would say on the general market has not really stemmed that far from where I began
We
my
started,
career.
right? Right?
Yeah, no, for
It's
sure.
crazy. It's absolutely insane to me that the rehab has not changed that much. And, as you know, I teach a BFR certification course.
Yeah, yeah, yeah.
And that course is sold out almost every single month that I teach it.
Amazing.
And I am, teaching, 40 plus clinicians across,
It's awesome.
continents.
So cool.
And it amazes me that even here today, I've been teaching that course for about 8 years. And here I am today, still teaching 40 clinicians who are treating ACLs and who are just being introduced to BFR.
It's crazy town.
To me, that should be a staple. It should be a standard of practice
Two two
for ACL rehab.
two standards of practice right here for me as we sit here. Data, like
Yep.
applied data, which your system, the Dorsivia AMI
Yep.
system, has allowed for significant strides in appropriate rehab. And we'll kind of circle back around to that because
Yep.
I kind of want us to touch on how it also has bridged a gap in communication with patients, especially in those end stage points. But the other one is restricted blood flow. I mean, how is that not a staple at this juncture, especially for ACL? What has been the number one complaint in 25 years, no matter who does the surgery, is quad wasting,
Right. Right.
really.
Right.
So if you can spare that with the use, can you give a short blurb for people that don't know what restricted blood flow is,
Yeah.
specifically, and why it's so important in post-surgical rehab?
For sure. So number one is you're placing a cuff either on the brachial or femoral artery. And you're not restricting arterial flow. You're restricting venous return. And so what ends up happening is that you place this cuff on the limb and you exercise at a very low load. So typically around 40 to 50% of one rep max. But you're doing a high rep scheme. So you've got this cuff on, you're restricting venous return, you're doing low loads, high rep scheme. What that does, it creates a hypoxic state in the muscle. So oxygen deprived state in the muscle causes a cascade of things to happen. Locally, there is a increase in motor unit recruitment, and that's where the quad recruitment comes into place because that distal quad, getting that distal quad to recruit, what you got to do is you got to put it in a very tired state, very oxygen deprived state, so that it recruits those muscle fibers for the distal quad. So from a motor unit recruitment perspective, that's fantastic. But what also happens, and what a lot of people forget about, is the systemic effect that it has down the road. Because if you do that for a long enough period of time and you're putting these people in this hypoxic state for a long enough period of time, there's a cascade of chemical reactions that occur. Number one is that you get larger amounts of release of growth hormone and IGF-1. And that really is, for me at the athlete lab, it's one of the things that I've been tweaking a lot because I found that you can use that chemical release to have a major biohack. There's ways to optimize that chemical release by making sure that nutritionally they are standard, or that they're solid. So making sure that they're getting good hydration and making sure that they have the essential amino acids to optimize the amount of growth hormone that is released, to optimize the amount of IGF-1 that is released. The
Because if
other
you're
thing
gonna
that
do it, right? If you're gonna do it,
do it
let's do
right.
it.
Yeah,
Let's do it
right.
right. Let's go
Exactly.
all the way.
100%.
Yeah. Okay.
And so I also deal with a lot of mature athletes. I say that by the over the 40 athlete.
Ouch.
And so one of the other things that I found is that I do a testosterone precursor with a lot of my male athletes specifically. And what they found is it's an all natural testosterone precursor that they use They use that in addition to blood flow restriction training. And we're seeing measurable changes on blood tests of testosterone levels. In
Wow.
addition to that, again, taking that biohack. So I'll do a heavy BFR session with somebody. One of the things I have here at my clinic is a red light therapy bed. So
Yeah, yeah, yeah.
it looks like a sun tanning bed, but what the red light therapy does is it causes your mitochondria to turn over protein synthesis at a faster pace, which means that cells are regenerating at a faster pace. So essentially, you're flooding their body with this growth hormone, this IGF-1, throwing them in there, kicking their cells in overtime. Like, it is absolutely amazing the results that you get when you do that kind of stuff.
So
So for me, the biohack piece of it is just as intriguing to me as what I get from a recruitment standpoint.
I agree 100%. And those are the things that we were seeing. Now, we haven't enhanced with the red light therapy that you're talking about, but even trying to pair restricted blood flow with some of the other more advanced strengthening techniques to accelerate and leverage, really,
Yes.
that's what we're talking about.
Yes.
Leveraging on a deeper level, really, than that surface, what I've always referred to as surface PT, like
Yeah.
surface physical therapy. Get them out of pain, they're moving okay, and as soon as they don't have pain, discharge. That's really not the brand that we're talking about. We're
No.
talking about, and grateful very much for including me in your indication of like the 1% of how we
Yeah.
practice. And as hard as I look, you're not lying.
Yeah.
It is super rare to kind
Yeah.
of
It
find
is.
people that are still so engaged in physical therapy. They're not jaded by the pressure and the reduction of
Right.
reimbursement and all the things that are happening to make things happen. And that's what you're doing. And even though it's like a smaller sector right now, this work is so important to keep us moving forward.
Well, that's the thing is too, is that, once you start having success, like you are,
Thank you.
once you start having that success, what's going to happen is your competitors are going to be like, how do I keep up? And that's quite honestly,
I
that's
can't.
by, yeah, well, exactly. But by raising the bar, everyone else is always going to strive to get to that bar. The better ones are going to strive to get to that bar. And so for me, that's how we're going to really truly change ACL rehab is by showing success and then having others try to mimic it in a way that is providing better outcomes than what we have today.
And I mean, we've talked about this before too. I mean, I have no issue with anyone trying to improve what they're doing, regardless in the town that I work in or across the country. It's really more about trying to, exactly what you said, raise the bar, raise expectations, expect more for your patients and for healthcare. And you truly, I will credit you for starting me on that journey for sure, because there was a lot of insecurity and indecision because it wasn't as well, it still isn't as well known, but once you know, you can't unknow.
Right. Exactly.
So the data and the progression, you're doing great stuff, man. And all
Well,
the
thank you.
research that you
I
do.
appreciate that. I really
Yeah.
do.
And you know what? Organically, I'm not sure, you can't see it, but it is sitting right over here. Organically, guess what I have on my shelf?
Aw. That's awesome.
Front and center.
Yeah,
Tell us
that's
just a
awesome.
little bit about this. It's Trent wrote a book called How to Build a Badass Firefighter.
Yes.
It's pretty amazing, and it
Thank
sits
you
right
very
up
much. I
here.
appreciate
Yes,
that.
of
So
course.
that was, so I've been doing this in athletics for quite a bit of time. And I got called to work with first responders. So for 3 years, 3.5 years, I worked solely with police and fire and military personnel. And what I was finding is that the same concepts that we were doing from a sports perspective could absolutely be applied to the tactical athlete. So that particular book is basically a deep dive into movement in how movement affects injury rates in first responders, and it's even more it's more impactful to a firefighter, a police officer, military personnel, especially when you start considering the environments they're in today. They're understaffed, they're overworked. I was working with one department that they're on 24-hour shifts, and of that 24 hours, they're probably on calls 16 to 18 of those 24 hours. So you think about the psychological stress and all of that. So mitigating musculoskeletal injuries is super duper important for the military. It improves combat readiness. With the influx of young recruits that we have today, they're just not physically prepared for the physical demands that their bodies are going to be placed under, and looking at human movement and how they move, and then addressing those movement patterns early on in their process, whether it's through boot camp or whatever. Addressing that stuff very early on is going to help them be more successful, and quite honestly, it's going to improve, not only combat readiness for the individual, but also for the branch as well as the country as a whole. So the book was really kind of a deep dive into that, and really, what I wanted to do is write a book that helped people understand movement, how movement affects you, what movement means, how do you create exercises for it, and then for the clinician, the last part of the book is actually on how do you make this a business, how do you market it, how do you convey it, how do you charge for it, how do you do all that.
Which is not normal
Mm-mm,
typically, right? No, it's
mm-mm.
usually very closely safeguarded. If
Yeah,
you develop something, which you are, you pioneered the 3D movement by far. And ever since I've started using the system in 17, I've become a easy target for everything under the sun for, hey, Andrea, can you look at this? What do you think of this product and
yeah,
this? Nothing has come close on biomechanics and movement to what we've seen with your system.
that's
Um,
awesome.
so the fact that that actually, and you put that out there readily, and you didn't know me from anybody, and I
Yeah,
called you and was like, "Hey, Trent, I wanted to pick your brain on a couple
yeah,
things." You were like, "Yeah, cool, let's go," and I was like,
yeah.
"Really?"
Yeah,
Which is, that's leadership, though. That's
yeah,
true leadership within the field, and I appreciate it very much. But that the firefighters, the police, the military, what most people probably don't understand unless you have a friend or somebody close to you that has served in one of those three, it's a very taxing job, both physically and mentally. And when you do something like the AMI, which essentially it's a series of tests with sensors on that identify deficient movement patterns and allow you as the clinician, you and I, to speak to those deficiencies in very succinct, specific ways. So it bridges that gap also between your athlete, patient, client, and the clinician. Instead of them saying, I feel great, I don't
right,
know what you're seeing. You're
right.
like, guess what?
Here it is. Here
the,
it is.
the numbers are pretty terrible.
Right.
So chances are pretty good you're going to get better. Have you seen that? Like, have you heard that a lot as far as,
Yeah, a couple of things. One is that thank you for that. You are one of the most prolific users of the EMI, and
you're
and one of the
very
early
kind.
and
Thank you.
one of the earliest adopters. And quite honestly, there's been a lot that I've learned from you and your use of the EMI, and
Oh,
that's one
wow.
of the benefits that I get is, through our conversations and things like that. So for
Thank you.
me,
Yeah, same,
yeah,
same.
yeah, so for me, the everything I'm learning from the EMI it's been an exponential addition, and that one of the things that I've learned is that it really does span across, your sport athlete to your tactical athlete, because at the end of the day, biomechanics is biomechanics. And we know that if we improve, not only do we improve or reduce or mitigate their risk, but we also have a huge impact on athletic performance. And one of the things that I find is that having good quality data and a way to present that to the individual that is visually appealing is super important. So you've obviously seen the differences between version 1 and version
Correct.
2.
Yeah, yeah.
In version 2, and to Dorsa V's credit, we sat down and we said, okay, where should this button go? One of the things that we had a long discussion around was the video, and the importance to me, the importance of the video, because I like to go back and show them, see, here's where you're shifting over to that side, and you see it in real slow motion. They're like, oh my God, I never saw that. So
Hmm.
that having the ability to leverage the technology to quantify the movement and to provide them quantifiable data. The other piece of this whole project for me is when I look at re-injury rates after an ACL reconstruction, they are
Hmm.
god awful. And in Andrea, you and I have been around
Disgusting.
the
It's
same amount of
disgusting.
time,
Yeah.
and those numbers have not improved in 25 years, despite all of the facts of all of these Instagram famous people that are doing these amazing ACL exercises and things like that. The data is the data, and the data says that we suck at ACL rehab. And we're even worse at making ACL return to play decisions.
Wait,
It's
wait, and add contralateral, right? Opposite side
right.
injury rates.
Right, right. So, one of the important pieces for me for the EMI was to finally provide an objective tool by which you could measure risk and performance uh, pieces of it, and provide that to a physician to make a much more informed decision for return to play. Because at the end of the day, what I think people forget about is it's not just a re-tear of their ACL. Is you see athletes who don't go back after that. They have higher rates of osteoarthritis. They have higher rates of diabetes. They have higher rates of obesity. They have higher rates of health related issues. So you've taken this athletic person and you've made them immobile or less mobile, and their whole life has changed. So to me, there's a much bigger picture of overall health that happens when you don't do it right.
And it's just, I mean, and we will definitely make time for another
Sure.
more lengthy in depth,
Yes.
because return to play for me, I mean, that was my motivation. The gap between where
Yep.
physical therapy ends and sport begins, there should be no gap,
Yep.
in my opinion.
100%. 100%.
Right? PT is also performance. So when you're
Yes.
testing and you're doing the data, you cross over into that performance line.
For
But
sure.
and it's not taking away from anybody who's in the performance field by any way, shape, or form. But when you're rehabbing, there should be a staged decision making process, and there should be a staged expectation.
Yes.
Right? I mean, it's all over the research. 12 to 18 months
For sure.
for legit return to play.
Yeah.
And we're seeing insurance pay 3 months, 4 months, maybe 6 weeks sometimes. Um, so you're in the concierge business to be able
Yeah.
to speak to that without restrictions.
Yeah.
Um, I'm sitting
Yeah.
in the straddle world
Yeah.
of both, but
Well, and people are willing to pay for that. People are willing to
it's that
pay,
valuable though.
yeah, to take them to the next level. And the sad part is I shouldn't have to take them to the next level. You know what I mean?
No, because we as a whole should be doing our
We should be.
job,
Yeah, we should be.
and the
We should be.
country as a whole should be providing insurance
Right.
for us to be able to do
Right.
that job. But
For sure.
that's a whole other it's a
Whole
whole
nother
other
another episode.
so give me your top three, like what I've been trying to collect for myself too, like, top three or four, I guess. Two things, takeaways, frustrations with ACL rehab and things that you've heard or
Yep.
seen, and then expectations for what you do, what I am aspiring, continue to aspire to do, which is that raise the bar, top level
Yep.
care. So if you could speak to that a little.
Yeah, from ACL perspective, where I see things go wrong, number one is a lack of focus on movement. Very early on, a lot of these movement patterns start to develop in the primary motor cortex, and if you don't start correcting those movement patterns early on, it's going to be something that can last. Quite honestly, I've seen athletes with lateral shifts that are 2 years post-op squatting under 405 pounds.
Oh
That sets
gosh.
up for tragic, back injuries, hip injuries, etc. The other piece of that is early activation of BFR
Yes.
and leveraging BFR to the max. Leveraging BFR with cardiovascular exercise, managing BFR with open kinetic chain moving into closed kinetic chain, moving into performance enhancement types of
Love that.
activities. The other piece is the neurocognitive training. Used to be new research. Now it's about 8 years old. In the impact that early on, as soon as the ACL is gone, from functional MRI studies, there's very good indication that there is a big changes in the primary motor cortex that is only trained when you do neurocognitive training
Okay.
and leveraging
Yeah.
BFR for that kind of stuff. The other piece of it is doing leveraging fatigue state training. The studies are very very clear on the fact that if you people's movement changes when they fatigue, and it gets worse after an ACL reconstruction. So really getting them to a fatigue state, I call it fatigue state training, but getting them to that fatigue state and really emphasizing good motor patterns in that. And then I'd say the final thing is really understanding the full aspects of the chemical responses of our body. Your internal chemistry should absolutely be a part of your overall rehab program, because if you are not addressing the internal chemistry, what you put in your mouth, you are not fueling the system to optimize the results. And I always go, so I had a minor in biochemistry, and we always talked about rate limiting step, right? And
Okay.
so, why should you allow your nutrition to be your rate limiting step in the full benefit that you're going to get from all the different training things that we do, and looking at other biohacks? There's a lot of other biohacks out there that you can leverage with BFR to really optimize that overall result.
Are you doing or seeing anything with the hyperbaric stuff?
Yeah. So funny thing is, so in the fight industry, they tend to be much more aggressive,
Sure.
much more
Yeah.
advanced, because you got a very short
Short bouts.
short time window to get
Yep.
people better. And
Yep.
somebody comes in with me to me for an injury, like I've got somebody coming in today to get treated so they can catch their flight so they can go fight Friday. So
Wow.
it's a very short time window. That said, it's been very progressive in some of the things that we use from a therapeutic standpoint. So one of the things that we're using a lot of is what's called BPC 157,
Okay.
which is a peptide from your gut. It is the peptide that causes your gut to regenerate your cells. And so what they found is that when you take BPC 157 and you inject it into an injured tissue, that injured tissue regenerates at a much faster pace.
Oh
So
wow.
here in Franklin, I've got a clinic that I work with that will do BPC 157 injections and then put them in a hyperbaric chamber to drive it into the tissue even
To
that much more
accelerate it.
effectively. Yeah,
Yeah.
to accelerate that piece of it. Then what they do is they come over and do the red light bed to turn on the cells over time.
It's intelligent stacking, right? So we talk a lot in
Yes.
business about tech
Yeah.
stacking, and now
Yeah.
it's biostacking,
It's
which
totally
is
biostacking.
yeah, that the hack method you're trying to optimize
Yep.
the outcomes. You want to create efficiencies. So how do we do that at the highest level? How can the patient contribute? How does your knowledge base, push you forward?
Yeah.
So fun. I wish I was in Tennessee. It's so
Yeah,
fun.
right. I know it is. You know what? And that's it. I've been very blessed in that regard. Number one, because I've got some higher end technologies that I can use for that kind of stuff. When I first started out with my practice, is those were separate things that you could purchase as a part of it. And I found, what, I just included it on everybody, because what I
Same.
found is that I
Yep.
just get the best result if I just if I throw the kitchen sink at you.
Same, and that's kind of I really accredit that too, because there were early for me anyway. There were early people, a lot of naysayers, lot of naysayers. What do you need technology for? You've been doing this 20 years.
Right.
Blah blah. But I will say the a la carte wasn't working for us either.
Yeah.
And when the results though, insane.
Yeah.
Like so when people talk to me about ROI, because that's all anybody outside wants, like, oh, what's your ROI? My ROI is my practice has grown exponentially in a short amount of time
Right.
because
Right.
time, attention, and really, I think it's that accelerated mindset to detail to
For
create
sure.
those efficiencies. So you're a beast, man.
Well,
Love it.
thank you. Thank you
Yeah,
very
give me
much. I appreciate it.
so give the people what they want. What should you not want to see if you're in the middle. Let's say you're in the middle of ACL rehab, you get to that running stage, and then this is what I hear a lot of times. Then they get put on cruise control for a little while.
Yeah.
So what should we be expecting? At that mid stage, like just past maybe let's say like I don't know, 20 weeks or so, like 4 or 5 months.
To me, there is no middle stage. It's just phased.
Hmm.
And I think sometimes we tend to go, I don't follow as much the protocol that I used to follow. I just constantly continue to push the person forward. And I think we need to probably go back at some point and reevaluate some of these protocols that we're seeing, especially with some of the things, the advancements that we're doing with BFR. There's good studies that are showing that the bony plugs are actually uptaking at a faster pace now
It's
with the
amazing.
use of BFR. We've got an orthopedic surgeon that's doing the internal brace and then filling that with stem cells.
Hmm.
And we're seeing a much more accelerated ACL process. You know,
It's
all,
Yeah,
all,
no, I mean it's exciting stuff for
yeah,
sure, but the protocols, I agree with you because I have my own protocol that's
yeah,
evolved
yeah,
since I started practicing, and now it's evolved even more with the use, like we have internal in-house protocols with the AMI and
yeah,
the BFR, where we just cycle back around and we keep checking to make sure the building blocks are still solid.
yeah.
You know what I mean? Like, is the quad still firing after new introduction of new activities? Can you still execute a straight leg raise without a lag? Like,
Well,
basic
and,
stuff.
and I'll give you a perfect example. I've had two recent cases. To your point about the running, I had an athlete who was supplementing her ACL rehab with me. So she
Mhm,
would go to her insurance base for 2 days and then me for one day.
mhm.
And she had gotten to a point where she felt like she was pretty good, just continuing on with her insurance base. Didn't see her for 2 or 3 weeks. 3.5 weeks in, she appears on my schedule, and she had started running and developed a patellar tendonitis. Well,
Okay,
when I looked at her doing a single leg squat and watched her quad activation had decreased, and her single limb stability had gone down, and now she's running.
yeah.
And so, I think sometimes we lose the picture, and the picture at the end of the day is optimizing human movement, doing whatever you need to optimize human movement. If you have a quad deficit, you cannot control frontal plane motion. You got to keep that quad going. You got to constantly be pushing their quads over and over again, and giving them that single limb stability. And again, part of what the EMI has taught me is for so long I just looked from hip, knee, ankle, and I was forgetting what was happening up at the center of mass. And the
Mhm.
center of mass, that movement of the center of mass drives force production through the limb.
Massive.
And
I mean, the
so,
core work is
yeah,
crazy,
yeah. So I'm doing
crazy.
a lot more rotational training now than I've probably done in the past.
Mhm.
And I keep that going all the way through. And what I find is that when you keep all those things in line, running does not become an issue, and you can continue to progress them forward.
We have not had an issue. I'll knock on wood
Yeah,
but return to run with a staged progression,
yeah,
return to run, we cheat a little bit and use the Alter G, the
yeah,
anti-gravity treadmill
yep,
early.
that's
But
awesome.
the running mechanisms and the patterns, I haven't had to do like
Yeah,
a deep dive on why people aren't running well because they all come out pretty
yeah.
darn clean. So,
Well, and two, as you stated with the Ultra G, I mean, you're already starting to build those movement patterns, those that pattern, the sequencing of firing that someone needs very early on in the stages.
mhm.
And you don't get that if you just go from nothing to running.
Which
There's
a
got
lot of
to be
people
that
do.
progress. I know there's got to be that progression.
And
And then you have some people who return to running and they still don't have frontal plane control, and then they
and
wonder why they develop patellar tendonitis.
patella tendonitis or patellofemoral
Right.
issues or
Yep.
whatever, or ankle pain, my
Yep.
ankle's bothering
Yep.
me, plantar fasciitis, yeah, all the secondaries. And it comes usually right back around
Yep.
to poor mechanics, poor core
Right.
strength, and hips. So You're awesome, man. And what else can we cover right now while I have you on? What would you like to
You
get
know,
out there?
yeah, one of the things that has taught me a lot, probably in the last, I would say, year, is working with combat athletes so much. And
Yes,
it's taught
yes.
me from a
It's
defo
different. It's very different.
it's a very different
Hmm.
population. It's definitely much more aggressive. I just did a big talk at a sports medicine conference on treating the combat athlete because for orthopedic surgeons, they're unfamiliar with the sport,
Yep.
unfamiliar with the stresses that go on the body. I always tell people I've got, my doctorate with a focus in biomechanics, and then I've got my functional PhD in biomechanics after getting my black belt in jujitsu.
Yes, a
And
little
and
bit.
yeah, and what it's taught me, the amazing thing that it's taught me is how to manipulate biomechanics. And from manipulation of biomechanics, you learn how not to allow someone to manipulate your biomechanics, which then goes to how do you actually create exercises that's going to prevent someone from manipulating your biomechanics.
So, I mean, my experience, high school wise, was wrestling,
Yeah,
and then had the good fortune of working with someone that was very, black belt,
yeah, yeah, yep,
BJJ, and my son currently wrestles in high school. So we are
perfect.
always
Yep,
yeah, so always battling those ideas, right? A runner needs to run, a wrestler needs to wrestle,
yeah,
and then how do you train a wrestler when you're not a wrestler, because
right,
there aren't many that are,
right.
PT wise, to be able to take up those forces? Because the positions that you guys get into, like that, there is something that should be said with education in
For
wrestling.
sure, for sure. Yeah, and in jujitsu specifically, what I tell our orthopedic surgeons is think about every special test that you've ever learned for the shoulder, for the ankle, for the knee. And in our sport, we take those to the in range of motion till it pops out of joint or someone taps.
That's
It's
true.
simple. I mean,
It is
every
true.
every single submission that you do for the shoulder is designed to make the shoulder pop out of joint, and it's very
It's
similar
who's gonna
to
cry wolf first,
right.
really, right?
Yeah, right, exactly. An anterior drawer on the ankle, we call it an ankle lock. So we
Hmm.
just yank on it until it pops out of joint. I mean,
Or you get
so
kicked in the head.
yeah, right, exactly. So
Yeah.
it's, that being said, understanding the stresses that those people are going to be going through, because part of the reason I started the athlete lab was I was seeing a lot of our fighters that would be doing leg raises on a table
Right.
and then they're good and they're good
Yeah.
to go and you're
Right.
good to go back. Okay. So you just, you had your knee destroyed because someone did a knee bar on you and now you're good to go back to get knee barred.
No,
There's no
my fa-
progression.
No, and my favorite statement more recently was from, of course, high school, but I don't, why are you having me jump on one leg? I don't ever jump on one leg. Now, listen, I sit at tournaments all weekend long. y- They pick the leg up, they're literally hopping up and down my
Amen.
legs. So
Amen.
it's insane that it doesn't translate
Yeah,
into that because you're
right.
just, doing what you do.
Well, and the thing is too is that you have the background and the knowledge to be able to share that with an athlete of why this is important and why you do this. If someone shoots in on you in a single leg takedown and they grab your leg, what are you going to do? Right.
Yeah.
So you
It's,
have that knowledge to back that up. And so, part of what I'm trying to do on this side
mhm.
is that I have with receiving of my black belt, I made a commitment to my professor and to my sport that I was going to try to develop ways to improve the healthcare of the combat athlete. And the first way to do that is through education. So what I'm doing is I've got a couple of courses out there and speaking at conferences on what is a jujitsu athlete and what are some of the positions that we get in from submissions standpoint, and what are some of the common problems that we see and how do you treat them?
And I mean, I would take that course now
Yeah,
because even like I love stuff that I have a fundamental awareness of, and you just try and level up with it. But I don't know that a lot of people within our profession would even know how to research or think that there would be something like that.
sure.
So I think that's going to be amazing for
Yeah,
our profession. So I mean, I appreciate all the effort you
yeah.
put in there, and I know tons of other people, especially our friend Courtney Green does as well,
Yes,
who
yes.
I'll be stalking her out soon.
That's awesome.
So, Trent, thanks so much for doing
Absolutely.
this. You're a beast, dude. Seriously.
Well, thank you
It's
so
like
much. I appreciate that.
I so much respect you and the work you do. And if I'm actually grateful that we're not in the same town, because otherwise, let's try and go toe to toe or team up and take over the world, buddy. That's what we're trying to
Absolutely.
do.
Absolutely. And I appreciate you, and again, I'm very grateful for the opportunity to be able to talk to therapists at your level, and just share ideas and continue to push our profession forward. So thank you for all the things that you're doing.
Thank you very much. And your humble nature truly is inspiring because the time you take, even, you're in an airport going to a lecture or going to teach somewhere, and you still hit me up with, hey, getting on a plane right now, call you in a couple hours.
Yeah.
Like, and I appreciate it very much. So you're amazing. Dr. Trent Nessler, where can we find more information about you? What's easiest?
Yeah, so two things, Instagram, BJJPT underscore ACL guide, or
That's
go to my
right.
website, which is theathletelab.org.
Love
I've
it.
got all my info.
Love the name. Love the
Awesome.
website. Love what you're doing, buddy. Thank you
Thank you
so
very
much.
much.
All
Thank
right.
you. I appreciate you. Thank
My
you.
pleasure. Talk soon.
All right, bye.
That's a wrap on this episode of Expect More with Dr. Andrea. I hope you're walking away with something real, something that challenges how you think about your health, your care, and what you deserve. If today's episode hit home, share it, leave a review, and make sure you're subscribed so you never miss the real talk. Because in a world that keeps shifting, one thing is constant. You should always expect more from your providers, your movement, and yourself. Until next time, keep showing up, keep asking questions, and never settle.